Boudreaux here. I'm a University of Minnesota trained transplant surgeon, a professor of surgery, been in practice for over 15 years now, board certified in general surgery and critical care. And I had a cholesterol challenge and was able to successfully lower my cholesterol 50 points with the BIOS Life. Being somewhat frustrated by some of the things that were happening in the practice where, as you know, I am one of the doctors of last resort, and that people come to me when it's broke so bad it can't be fixed and needs to be replaced. And so transplanting patients with perfectly good livers or pancreases or kidneys, only to have them succumb a few years later to the same thing we all get, strokes and heart attacks and cancer and other presumably preventable disease. One particular experience that struck me was when a patient came to me about 7 or 8 years after his combined kidney pancreas transplant. He was about 33 years old, had diabetes and renal failure. He had diabetes since a very early age. He had a successful pancreas and kidney transplant, and then after about 4 or 5 years was seeing other physicians because his health plan changed. He then showed up in my office after a several-year absence and said, "I really would like to see you, even though you're, quote, out of plan." I said, "I'd be happy to see you. I haven't seen you in 3 or 4 years. Tell me what's going on." He was very pale. He had angina walking about 20 feet. He couldn't carry a laundry basket of clothes down the hall in his house, and he would get chest pain going from his car park to his office. He was hospitalized right away and evaluated by cardiology, and to make a short story even shorter, he had non-bypassable, non-correctable coronary artery disease, and his cardiologist gave him about 6 months. His kidney and pancreas transplants were working fine. His 42-year-old brother had just died of a heart attack. His 44-year-old brother had just had a 4-vessel bypass. He was 43. And I was recently aware of the BIOS Life and a new product called Cellular Essentials, which was designed to reverse coronary artery disease without surgery. And this patient certainly was not a candidate for surgery. He also had a serum cholesterol of 280. And I offered him some BIOS Life and Cellular Essentials and said, "Would you be interested in trying something alternative to what you're trying now, since it doesn't seem to be anything that we're doing seems to be working?" By this time, he had been 6 weeks in the hospital, and he went home taking BIOS Life 2 and Cellular Essentials, and I was really curious to find out what would happen and whether these products would interact, to suspect there would be any adverse reactions, but still I was a skeptic and uncertain. 6 weeks later, he walked into my office and said, "I'd like to go back to work." I said, "What are you talking about?" He said, "Well, I mowed my grass yesterday. I didn't have any chest pain." His blood pressure ending was 120 over 80. His cholesterol had decreased to 180 with no change in his diet and on no lipid-lowering agents. So we let him go back to work. About 3 months went by, and I couldn't get him back into the office until after consistent badgering. I knew he was still thriving. I would get his twice-monthly labs across my desk and showing everything was in good working order, but I couldn't get him back in the office. Finally got him back in the office at the end of the summer and sort of read him the riot act for asking where he was all summer, and he said, "Well, I just came off of 109 days straight of 12-hour shifts." He worked at a plant as an engineer, and we had a big plant turnaround, and I couldn't leave. Now, this was a man who 6 weeks previously was sent home to die, was now working 12-hour shifts without chest pain. I guess everyone has a seminal event that sort of convinces them, and I guess that was my defining moment.